Dr. Kumar. We're live right now, actually.
How's your week?
Oh, it's good. I've had some technical issue, but I'm good.
Awesome.
And yeah, and then we're gonna say hi to Alpha in the space. We're streaming now on Facebook, YouTube, Twitter, all the wonderful places. But what we're talking about today is very important, and I think especially for women's health, which has been so like so misunderstood. I mean, I thank goodness I don't have any problem with that, but a lot of the girlfriends of mine have went through this.
Yeah. The unfortunate part is PCOS is something that's recognized, and in my experience, the patients that I've seen have been managed with band-aids, not really looking into the underlying issues, and so that's what I want to kind of highlight so that people are aware. I'm not saying that we need to go crazy and over something that we need to keep in mind when we are managing women with medical and healthcare issues. So that's the intention that I wanted to pick this topic. Shall we go ahead and get started?
Yes,
Okay.
please. I went ahead and pinned the two PubMed stories that you wanted me to have so we can have it as reference, and then we put on YouTube video.
Okay.
I go ahead and pin it up
Okay.
there.
Cool. So PCOS occurs, and this is kind of shocking. Between 5 to 15 to 20% of women of reproductive age in the U.S. and around the world. So can you imagine 1 in 5 women of reproductive age being affected by this condition? And so, how do these patients show up? Into a healthcare facility or wherever. So, number one, um, reproductive age, menstrual issues, infertility, obesity, mental health issues, hirsutism, which means facial hair, hypertension, diabetes, endometrial cancer. I mean, the list goes on and on and on. So, a woman may show up at a and all you do is treat acne and send them on their merry way without figuring out what's going on, under the surface. And PCOS is one of those issues. So, how about obesity? People come in for weight loss, go wherever and try all kinds of issues, all kinds of treatments, but the obesity is not going away. You know, they keep bouncing back like yo-yos, and nothing seems to be working. Why? Because the underlying issue is PCOS, and it's not been recognized. Or they may show up with male pattern hair loss on their head. Why? Because of increased testosterone levels. And again, you get all kinds of things done. You do PRP to the hair and go crazy about all kinds of things, but the underlying issue is PCOS. There we go. So there are so many issues that people can show up with and are treated by whoever with something like a band-aid, but without figuring out what the underlying issue is. And PCOS is something that we need to keep in mind because the incidence is so high, and if it is managed properly, it can be taken care of. Okay, so the common question is, what's the underlying cause for PCOS? By the way, for those people who do not know what PCOS is, PCOS stands for Polycystic Ovarian Syndrome. PCOS. So, what's the underlying issue? There are two underlying issues here, and I'll kind of walk you through some of these steps. Don't You don't have to be worried about all the finer details, but I'll kind of spit it out so people will have an understanding. But don't go crazy if you kind of miss the point. The underlying issue here is it's multifactorial. It's multiple things going on at the same time. Some of it is genetic, some of it is acquired. But what's the main issue? the main issue here is actually there are two. One is increased insulin resistance. What does that mean? Insulin resistance is something that occurs as anybody gets older, whether it's man or woman. It's basically the insulin has a hard time working, pushing and lowering the blood sugar levels. So the pancreas responds by an overproduction of insulin. So insulin is trying its hardest to lower the blood sugar levels, and it's not going anywhere. And that results in obesity, deposition of what's called visceral fat, which means gut fat, which helps convert testosterone into high levels of estrogen. So it's high levels of estrogen that stimulates breast tissue as well as the uterine tissue, which is the lining of uterus, which is the endometrium. So when it overstimulates the breast, can result in breast cancer. If it overstimulates the endometrial lining, can trigger endometrial cancer. You see how this kind of escalates. And the second issue here is what is called increased luteinizing hormone levels. So luteinizing hormones are secreted by the pituitary. For some reason, it's this overstimulation or overactivity of the cells that produce LH. So that causes increased testosterone levels, increased levels of so increased testosterone levels that causes increased turnover of testosterone into estrogen in the visceral fat, increased aldosterone levels, water retention, hypertension, and all the things that causes that, which means atherosclerosis is increased, worsened, heart disease is worsened, um, and so there's just an escalation of issues that happens because of these two underlying things. And the attached um, article that I sent you, Tanya, talks about how this whole thing is in a background of a very chronic pro-inflammatory state. So as you can see, patients are really, really, really miserable when they're dealing with PCOS. So what do these folks do? They have infertility issues. They run to their IVF clinic or whatever. But again, without looking at the underlying problems. So what are these things? Um, they look very similar to other medical conditions. So this is where very careful medical evaluation needs to be done, whether the gal or the woman presents with, whether it's facial hair, and so they go and get, so laser hair removal. Now they get it done, but it persists and it worsens. Or like I said earlier, hair loss on top of their head, just like male pattern baldness. Again, you have to consider this. So thyroid abnormalities are conditions that can mimic PCOS. So that needs to be kept in mind. There's a condition called hyperprolactinemia, which means there's a small tumor in the pituitary that can produce an overabundance of prolactin that can mimic PCOS. Ovarian and adrenal tumors that secrete testosterone um, needs to be kept in mind before you jump in with a diagnosis of PCOS. So these are some of the issues that has to be taken seriously, because there is a way of handling it with some expert diagnosis and management. So how do we address this? And I know I kind of ran through this kind of fairly quickly, but just bear with me. So once it's recognized, we have to deal with the elevated levels of testosterone. So how do we do that? Um, with uh, uh, with a medicine called finasteride. It's a blocker of um, testosterone. Again, I'm not going to go into all the finer details, but it's something that I'm just going to kind of generalize. But each patient with these unique conditions has to be validated by a physician so that we can custom make a treatment plan for each person. And by the way, not every woman with PCOS is obese. There is something called non-obese PCOS. So please keep that in mind. Just because a woman is thin doesn't mean she doesn't have PCOS, but may have all the other underlying issues and symptoms. So, and we use a medicine called spironolactone to manage their hypertension and their cardiovascular issues. So, how do you reduce insulin resistance? This is where a diet program really needs to come in, and has to be. So, one of the things that I kind of prescribe is Mediterranean diet. Among all the diets that we've seen, Mediterranean diet seems to be the most healthiest and the most effective. The second diet that I prefer is the intermittent fasting diet, and along with metformin and a program of exercise will really make a difference in terms of lowering insulin resistance, kind of helping obesity. Because the key here is this: if you reduce visceral fat, and liposuction is not going to remove visceral fat. Visceral fat is a metabolic issue, and it's in the fat inside the belly, among the organs, right? So that is a place where the testosterone gets converted into massive doses of estrogen. So by reducing visceral fat through these programs, whether it's diet, exercise, and metformin, you can decrease insulin resistance, improve metabolism, and reduce visceral fat. That will help reduce the hyperestrogenic state. So that is the second thing that we need to work on. And the third thing is cancer screening. Again, as women age, make sure that we check their mammograms, endometrial biopsies, and stuff like that, to make sure the hyperestrogenic state is not creating a fertile bed for breast cancer and uterine cancer. And for irregular menstrual periods, contraceptive pills that can help to kind of even out the cycles. You can always try IVF for fertility issues, because it's an ovulation, which means the ovaries have the ova, but it's just not being released because of the hyperestrogenic state and in this all these hormone abnormalities that we see. So that, in brief, is the whole story about PCOS. So, summarizing, it's a common issue among reproductive age women. It's routinely misdiagnosed or underdiagnosed. Um, Patients with this condition can show up with the dermatologist's office with male pattern baldness, or facial hair, or acne, for example, and they may get treated just for those specific conditions without going through a full medical diagnosis. Or they may show up at a clinic, complaining of weight gain and obesity, and again, without helping understand the underlying issue, you're put on a diet program, and that doesn't even make a dent in the whole situation. Or they may show up with irregular vaginal bleeding, again, because of irregular periods, um, leading to infertility and all these other conditions. So that is something that has to be kept in mind. Or they may show up with hypertension, cardiac issues, pro-inflammatory condition, aches and pains and just not feeling right, depression, all kinds of issues, and that can worsen the condition. So there we go. So what are the basic treatments? We need to manage their increased testosterone levels, improve insulin resistance, which means reducing insulin resistance through diet, exercise, and metformin, cancer screening, and contraceptive pills. Any questions?
So, Dr. Kumar, I was just like, but when you go on a contraceptive pill, I mean, when I was on the pill, I gained a lot of weight,
Right.
and is that, I mean, is it kind of counteractive as far as what to say to lose weight?
So there again, there are so many moving parts here. You touch one, you're going to have an effect on the other, right? So the thing is, hypertension is something that we need to consider as one of the indications. Again, not everybody who is who's infertile, because there are a million reasons for infertility or irregular menstrual periods. PCOS is just one of them. So I don't want people to take away the message saying that, hey, I have irregular periods, so I must have PCOS. No, you need to check with the gynecologist, make sure there's nothing else going on in terms of these other conditions that we talked about, which means, make sure that your thyroid hormones are checked, your pituitary hormones are checked, and all these other good conditions are all taken care of. So you have to consider PCOS as one of the etiologies of this. So weight gain, again, there are billions of reasons why people gain weight. PCOS is just one of them. You see? So all I'm trying to highlight is PCOS, it can be managed once it's diagnosed, right? So instead of pushing it under the carpet and not being aware of it or ignoring it, everything else that people will be doing will be like a band-aid. You see? So that's the intention why I wanted to kind of highlight this. People need to take this into account because 1 in 5 women of reproductive age has this condition. And I'll take a bet how many of them are being managed appropriately. I think
not too many. Not too many. I have friends who have this, and it's the first time I even heard metformin for it. Actually.
Oh, absolutely. Metformin is the treatment once we diagnose PCOS. Trust me, it really works, reduce visceral fat, improves insulin resistance. And again, it is how you're going to reduce, like I said, what are the 2 main ingredients of PCOS? One is increased LH, which means worsening testosterone levels, which means increased estrogen levels because of the obesity. And number 2 is the increased insulin resistant state. So those are the 2 conditions that are fundamental to the diagnosis of PCOS.
So we have a similar question on. Do you have a question for us?
Yeah, actually, I have Polycystic Ovarian Syndrome. I'm 41 years old, and I just wondered if you guys would be interested in using me as a case study. I could, as a confirmed diagnosee, I could tell you some stuff or ask questions.
Absolutely. Oh my God. Okay. Listen. So, give us your story again. You can go into as many details as you can. Or, again, this is an open forum, so I'm going to leave it up to you to tell us as much as you like or as little as you like. But I would really like to understand. Are you one of those patients who were underdiagnosed or misdiagnosed or not diagnosed? Was it a struggle for you to get the right physician on board, for you to get the right treatment, and how did you respond? So those are the questions that I think everybody would be really interested in knowing. Go ahead.
So I had, I never, I think my problem started even before puberty. I never had regular periods, and I had, I don't want to be too graphic, but I had basically abnormal spotting for a very, very long time, and I never sort of had a period the way that it would be described in a textbook. And I was born in 1980, and I don't think PCOS existed as a diagnosis until 1995. I'm in Canada, so they weren't really on top of it. Does that scan with what you know?
That's right. Again, this is something that when I was in med school, the mid 90s, PCOS was a small little paragraph in our GYN textbook. Not much was known about it, unfortunately.
Exactly. So of course I was misdiagnosed because it wasn't, unless somebody was a specialist or they had recently been in med school or they had gone to a seminar on it, they weren't briefed on the possibility that this was happening. So I had horrendous acne, which I'm not really that bothered by it, but based on how people reacted to my face, it was pretty bad. So because I had horrendous acne at the time, they put me on erythromycin every day.
Wow. Okay.
Yeah. So
that's a band-aid. Again, that's a band-aid. Yeah, we need that band-aid too. but I don't think they saw the underlying issue. Okay, go ahead, please.
So the erythromycin caused a lot of problems, and it did not help my acne very much at all. And then eventually I put myself on birth control when I was at the age of 14, because a lot of people around me were getting pregnant, and I wasn't sexually active, but I wasn't going to get pregnant. So I live in a place where the age of medical consent is sort of based on ability. Like, it's if you can come and you can speak and the doctor can judge that you can make your own decisions. So like, I think formally it can't be less than 12, but I was certainly capable, and I was practically an emancipated minor at that point anyway. So then I got on birth control. My skin cleared up, which was amazing. But it did not do a dent really to my period problems. It may have made them worse, in fact. And because they really messed with me, because they don't want, when you're young, they don't want you to be on like heavy doses of estrogen and kind of mess up your cardiovascular system. So they gave me the newfangled like light dosages and stuff, which it was super lovely for my skin, but I wasn't great for managing the cycle. How does that scan?
Okay, so there's a lot of issues with birth control medications way back, and things have changed a lot since then. Again, I'm not a gynecologist, but I do know the present kind of birth control pills are a lot more kind of bioidentical compared to the ones that were previously known.
Well, I can give you a specific kind. So I was on Diane 35.
Okay.
Do you know Diane 35?
Not really.
So it has a little bit of something extra in it that helps with PCOS, but they were making me take the week off. So I would cycle horribly with it, right?
Okay.
We didn't have the protocol where you could take birth control for 3 months and then have a period. I was supposed to, take the sugar pill week. So it never really worked for me. I'll just fast forward a little bit. I ended up taking sapropterin acetate.
Sapropterin, yep. Okay, go ahead.
So I was allowed to take that because I got a tubal ligation, so there was no risk of me messing up a fetus with it. So I took that at 25 milligrams a day, or 15 milligrams. I either took a quarter of it or I took half. So it was somewhere between 15 and 25 milligrams a day, and that was fantastic for many years. But then I started noticing changes in my breast tissue. They started getting really heavy and dense. And, immediately when I took the sapropterin acetate, my breast got bigger, which I didn't really want. I became more feminine because of, how it changes your hormones, which was just something I had to suck up if I wanted to feel better from the PCOS. Anyway, eventually I also have endometriosis, and eventually I got my uterus taken out, and I still have PCOS, and I would love to get my left ovary removed. That's where I'm at. And I have questions about what they the kinds of surgeries that they do on the cysts, and when and why don't they do it more often.
You're talking about the ovarian cyst?
Yes, I'm talking about the ovarian.
Okay, so ovarian cyst is a result of this excessive estrogen production. That is not the underlying cause. Guys, people think that fixing the ovarian cyst is going to solve the PCOS problem. No. That is a result of a hypoestrogenic state with a low progesterone state.
I just want to say I was also put on metformin and a blood pressure, spirulactone. Sorry, go on.
Spirulactone, okay. All right. So, but how long did it take for you from the time that you were suffering to the time that kind of the PCOS was kind of diagnosed and spirulactone was introduced and stuff like that? What is the time frame?
So it wasn't too bad. It was
it wasn't too bad. Okay.
It was, because I think the word got out like around 1997, maybe 1996, and I finally got a doctor who was briefed.
Okay. That's cool. So that's the issue, because we thought, again, this was my concept way back, that PCOS, the cause of the whole problem was the polycystic ovary, right? So if we get the ovary out, maybe it will solve all the problems. No, the problem is not that. That's the result. You understand? So
sure, but I have to say I have a lot of acquaintances who are trans. They're transsexuals, and when they go on testosterone, they feel amazing if they have PCOS. So I just want to sort of.
So the thing is this. So what happens is, in that condition, increased testosterone will actually suppress ovarian activity. Relaxing
man, that's what I
suppression.
want. Can I have
Yeah.
some
Oh,
testosterone?
no, you're already, listen, if you have PCOS, your testosterone levels are sky high already. Take a look.
That is one of the problems. That is not actually what my test results showed. What my test
I
results
see.
showed was that I had luteinizing hormones that was always elevated.
Okay, so let me kind of figure this out. Okay, so the reason is, did you have visceral fat, obesity as an issue?
No.
Okay, that is a good thing, because testosterone. So when you have testosterone, it actually converts it into high levels of estrogen. So for whatever reason, testosterone level may not have been an issue with you. You understand? So the
Totally.
insulin resistance was more of an issue rather than a testosterone issue. So you can kind of subdivide PCOS into these. That's the reason I said one is a testosterone issue and the other one is an issue with insulin resistance. You see? So if somebody has testosterone issue, which looks like you did have at some point in time, right? When you had the acne and so on and so forth.
Well, I have a
That's
pretty good beard right now. Yeah.
okay. No, but so I think it's like a mixed picture. So I'm not sure how to explain it. Um,
No,
because
I totally agree, but it's
yeah,
also insulin resistance is very difficult to manage.
yeah,
I mean, I follow a PCOS, endometriosis, and pre-diabetic diet. That's what I do, you know?
yeah, absolutely, absolutely. Well, hey, listen, one of the things that you may want to try it out is this intermittent fasting diet. See if that works.
I mean, I have digestive issues from the
Okay.
erythromycin destroying my digestive system when I was
Oh,
11
boy.
years old. So I intermittently fast against my will all the time.
Okay. So one of the things I'm going to throw this at you. Okay. One of the things I'm not sure where you live, but go check into this new concept of this chronic inflammatory state. So what can help in that? Look at some supplements that contain NAD, like NR, NMN, the precursors. So if you can have access to NAD IV, that is something that you may need to consider as an anti-inflammatory agent. And you can also look into, again, I'm talking in general terms, not specifically for PCOS. Now I'm addressing chronic inflammatory conditions, okay? Oxidative stress and chronic inflammation. So some of the things that has come to my consciousness is high dose vitamin C. I'm talking about 25 grams, 50 grams a week, if you can get it IV or orally, if you can handle it. It's one of the best known anti-inflammatory agents that there is in terms of chronic inflammation or NAD. Kind of explore all these conditions, and I think that can kind of mitigate some of the issues that has not been addressed so far. Because I think that's
I don't mean to hog, but I did see a naturopath, and one of the things she did was put me on evening primrose oil, like linoleic acid, which I took by the gobful, and it really helps. It really helps.
Cool. See, these are the kind of things that we need to know. So we can I can do some research on it and start talking to patients about it. Because again, it's a combination of whatever works in traditional medicine with whatever works in the other
I also
world.
really enjoyed acupuncture.
By the way, I do acupuncture. It's a lot of fun.
That's amazing. That's so great for your patients. It really helps.
Oh yeah.
It really,
Oh my
really
God.
helps. It's one of the only things that sort of like can balance out hormones that isn't other hormones or hormone suppressants,
Listen, I have no idea how it works, but I know it works. So I doesn't bother me. I'll just go ahead and throw a few needles in.
Dr. Kumar does acupuncture wherever he goes. We were at a conference together, and he was giving people acupuncture. No, he gave my girlfriend acupuncture. She was having a headache.
Sitting in the lobby of the hotel, of the I think it was the Hyatt Regency in Miami on Brick Hill. I remember that. I was throwing needles at anybody and everybody who had any kind of pain. That was
Can I just voice one last frustration, and then I'll try
Please.
to shut my gap. But the thing that I had a wonderful surgeon for my endometriosis, and then
Mhm.
I hope to use him for treating my Polycystic Ovarian Syndrome, because it was
Mhm.
I'll just tell you guys where I live and what my deal is. I live in Ottawa, and there's this place called the Shirley E. Greenberg Center for Women's Health in
Okay.
the Ottawa Hospital, and they had a pilot program to help people with endometriosis specifically, but they don't
Mhm.
have a pilot program to help people with polycystic ovarian syndrome. So I couldn't
Mhm.
go in and get both of my things dealt with at the same time. I
I
had to
see.
see different specialists, and they wouldn't talk to each other. And I'm like, guys,
They're feeding off each other. Yeah.
no, I mean, like my endometriosis doctor wouldn't deal with my or work with my ovarian doctor, even though they were in the same women's health center. I know.
And the organs are so close by. They don't want to talk to each other.
Yeah, they hang out in the same break room, but they won't share a patient. Thank you. I know. I felt like I was taking crazy pills. I'm like, guys, just call. She's right there. We can just call her and say, come into the office for 2 minutes.
Hey, listen. One word of I'm sure you guys know this. We traditional medical doctors are all living in our own little silos. I'm the king of my silo. Thank God about 5, 6, 7 years ago, actually Tanya helped me break out of my silo. Okay, I'm an MD. I'm a radiation oncologist, for God's sake. And I broke through that silo, started working in sexual medicine and all kinds of stuff. Again, my whole interest was, how do you deal with difficult medical issues? And the breakthrough came in when I went for training at Harvard Medical School in acupuncture. And that was my breakthrough. When I'm talking about breakthrough, the real breakthrough from my silo of oncology, this cancer world, I said, I can do so much more benefit for my cancer patients if I just included some of these things that I was never trained with, that I had no clue about. In fact, we were trained to oppose it, to oppose alternative medicine, to oppose vitamin C, to oppose acupuncture, to oppose aromatherapy, to oppose meditation. You trust in surgery, chemo, radiation, and that's it. That's what you were paid for. That's what you do. And don't even think about anything else because you don't have time. And thank God when I bumped into people like Tanya and a whole bunch of folks through her, that I finally saw the light. And so my life has been so fruitful. I've been able to help so many other patients, because I just expanded my horizon. Again, why did I get involved with PCOS? My interest, family. I have so many of my family members with this PCOS business that I said, you know what? I think I'm a smart enough guy. I can learn this stuff and figure out a solution. And that's where the passion came out. And I've been able to help so many of my friends and family with PCOS that nobody else could. I mean, that's a tragedy. And that's the reason why I kind of wanted to speak out today.
So it's 2:01. We promised it'd be a 30-minute space, but Poison, I noticed you did you have a question?
No, well, I did, and then I didn't, but I just really came in. I saw that y'all was chopping it up. I actually do kind of have one, but it's not for like ovaries and stuff. It's like for like some other stuff. So I was just waiting, you know what I'm saying, till y'all got to the next topic before I came on and started asking my questions. But basically, what I wanted to know is I kind of already had like a assumption, but Ramesh, I think you're an actual doctor, right? So yeah,
Yeah.
and you went to Harvard, so you might be able to help me out even better with this. So
Okay, go ahead.
like in my community, like a lot of people are getting like hooked on like Adderall and stuff.
Uh-huh.
The I feel like I already know, because for me, I went vegan for like 7 years and my energy was through the roof. You know what I'm
Mm-hmm.
saying? Like, my energy was, I felt like I was 16 again. And I
Mm-hmm.
still have reverted to like eating like chicken. I don't really eat too much red meat and stuff like that. And I eat like a lot of fruit and a lot of vegetables. Like I
Mm-hmm.
feel weird if I don't eat a lot of fruit. So
Mm-hmm.
like I know like it has to be like a substitute for like, or just like some kind of other, you know what I'm saying, thing that you can take that will give your body that same feeling. You know what I'm saying? And
Yeah.
uh
So I have two suggestions for you. I have
okay,
two suggestions for you. Okay. Again, from an overall health point of view. Number
right,
one, probiotics. Okay. When you said that you converted to, change your diet to a vegan diet and how you felt,
right,
that what you did there was to revitalize your gut health. Your
exactly,
gut health is connected to your brain health.
big facts.
Okay, so that's one thing. It's fairly simple to do. Probiotics, anything natural. The probiotics that I recommend is basically kimchi,
Kimchi.
sauerkraut. Kimchi, it's a Korean.
I'm writing these down right now. Kimchi.
Cool, cool. Kimchi. Kimchi. Second
Okay.
one is sauerkraut.
South. It sounds. Oh,
Sauerkraut. Yeah,
how do you
sauerkraut.
spell SoundCloud?
Yeah. Okay.
I,
And the
I,
third thing is kefir. Kefir. That's kind of a
okay.
yogurt.
Okay. Kefir.
That kefir. Yeah.
And what's the
That.
second one was sound? How do you spell the second?
Yeah. Sauerkraut. Sauer.
Oh,
Sauerkraut.
sauerkraut. It sounded
Yeah.
like you were
Yeah,
saying
well,
like a new thing.
No, no, no.
Sounded
okay,
kind of
what
like
do you put on the hot
SoundCloud,
dogs?
really.
Not SoundCloud. No, sauerkraut.
Okay.
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 And then the last thing is, listen, you have no idea on how much walking on earth with your
Right.
bare feet will make a difference. It's called earthing or grounding.
And I look. That's like. See, I knew this. Like, I'm actually asking these things because, like, now I'm around like family that I don't really, and I do my research on things. You know what I'm saying?
Yeah.
Myself, I'll be able to see these things, and now it's a point where I would like to, before I like just stepped in and try to take away something somebody feels something about. I'd rather have like something I can give them to be like, man, well, you know what I'm saying? Try this then. You know what I'm saying?
Yeah.
Like,
Yeah. Yeah.
see what this is. But just like you're talking about earthing, like, yeah. I think back in like 2012, I ran into a guy called the 13th Son
Uh huh.
on YouTube,
Uh
and,
huh.
and he was like telling us all about, you know what I'm saying, grounding. We would like actually dig holes and like put our feet in there and then water our feet. Water our feet.
I don't think I've recommended that be a plant. But guess what? Hey,
Yeah,
listen, there is science behind it. And you know what the science is?
right.
We, as human beings, okay,
Mm,
we are in what's called an electron deficient state.
facts.
Okay. So
Yeah,
when you're grounding, literally grounding, the electrons from Mother Earth gets transferred into your body.
right.
You need neutralize that oxidative stress that you have. Listen, I had no idea about this till about 2 months ago when one of my patients was telling me. I said, this makes absolutely no sense. Okay, but once I read up on it, and there are actual academic articles talking about the beauty
Earth.
about grounding that
Yeah,
helps so many conditions across the board, whether it's sleep issues, pain issues, whatever, across the board,
right.
and it costs you nothing.
Yeah, man. Exactly.
Okay, can you imagine? So, you know what? You know what's going to happen since I've gone public on this?
What?
Nike is going to come in with a shotgun and blow me away.
Oh,
Yeah.
like a shoe with no sole on it. Like, oh man.
So that's what I think it's time to wind up,
Yeah,
Tanya.
I
I
think
think
it is.
we're
We've gone past our
over the
30
time.
minutes short health space, but thank
Okay.
everyone for
Enjoy
being
talking to
here.
all you guys today. This has been
Yeah,
amazing.
Oh,
we'll be back next week.
Tanya, you actually just hold like short spaces sometime. Like, so this was like
Yeah.
you came in with a planned thing, like you was coming in for your 30 and you about to hit the road.
Yep, this is it. But we'll be back next week at
We'll
Oh,
talk more.
fire,
1:30.
fire, that's
Hey,
fire.
listen,
Okay.
give us some ideas on the topics you guys want to hear, and message me at 772-332-9975. Any topic that you prefer. I'll prepare well. I'll break it down into something that people can easily understand. And again, my whole goal is to make medicine easy. Make medicine easy, and hoping that we can use natural stuff that's around us to heal ourselves,
Right.
and be less dependent on big pharma and doctors and MDs and all this BS. All right, guys. Adios.
All right.
Bye,
So
everybody. Thank you.
Take care.
I'm gonna definitely be here early next time because I really want to chop it up with you guys. I'm gonna get my questions and stuff together.
Okay, cool. Thank you.
Bye,
Bye.
everybody.
Bye.